I frequently get asked about biting and autism. Is it a sign of autism? Is it a part of autism? What can I do to help my child or clients stop biting? So today, I am answering that question for you. Hi, I'm Dr. Mary Barbera, autism mom, board certified behavior analyst, and best-selling author. Each week, I provide you with some of my ideas about turning autism or signs of autism around. So if you haven't subscribed to my YouTube channel, you can do that now. Each month within my private online communities, I provide a monthly Q&A call, and this month I tackled the important questions about biting and whether that's a sign of autism or a part of autism. So I thought I would replay that for you. As a registered nurse and a board certified behavior analyst, I think biting, kids with autism or signs of autism who biting is one of the most serious problem behaviors that I can think of. It will get kids thrown out of preschool and daycare, which I did a video blog on. It will get them into restricted placements, like older kids who bite will sometimes not be able to continue on in public school. They'll have to go to autism school, and even where professionals wear bite guards. And when I think of biting, it is just something that we have to tackle as early as possible. So biting, human bites are actually even more serious than animal bites because we have more bacteria in our mouth. And if you get a bite as a professional or even as a parent or a sibling, it could lead to the need to see a doctor, get blood tests, potentially go on antibiotics, stitches. You might need stitches. I've even seen biting where it's caused ligament damage, nerve damage. And so I don't mean to scare you, but biting is very serious. Even parents who think that the child is just being playful and it's kind of like biting when they get excited, kind of happy bites versus aggressive bites. Biting will get you thrown out of really important places. So biting should not be something where we're like, that's just a part of autism. It's not. Biting can be an indication that kids can't communicate well, and we need to teach them to communicate, and we need to prevent biting. If a child or somebody that bites has hepatitis B or AIDS, for instance, that can be even more dangerous. So biting should not be. We should tackle that quicker than most other behaviors that I can think of. So as I said, I did a biting or getting thrown out of daycare and preschool video blog in the past. I've also done a ton of video blogs on autism and aggression, hitting, and other problem behaviors. And I did a really good podcast interview with Dr. Timothy Bulmer, and he is an autism expert researcher, and he specifically talked about biting as a response to pain and stress, and really helped me think about biting. So kids that bite, whether they bite themselves or bite others or bite objects, it could very much indicate that there is some pain or stress that they're not able to communicate. And then we can also have the happy, playful biting, almost like puppies bite, and they get too excited. So we're going to cover all of that, how to assess and use the 4-part turn autism around approach to really tackle biting. So getting back to Dr. Bulmer, he said that the research is clear that animals like birds and mammals bite themselves or bite objects when they are stressed and or in pain. And also, if we think back about before anesthesia, many decades ago. Think about the old cowboy movies of where they'd bite on a towel during like some surgical procedure or some just, painful event where they'd bite on a towel to try to relieve the pain. I know for my son Lucas, he bit people occasionally when he was young, and then when he got to be a teenager, he bit himself at points, and we could really tie that back to having allergy, headaches, pain, and we really know that is caused by pain in his situation. So let's talk about the 4-step Turn Autism Around approach to tackle biting. Step 1 is assessment. And when we talk about assessment, we're not diving in specifically right away to the biting. We're looking at the whole picture, the age, the ability level, the communication level, whether the child has allergies, whether the child is on medication, whether they have eating, sleeping, potty training problems, how they communicate. Can they demand or request for what they want? Can they label things? Can they answer questions? We also look at how are they socially? How are they with imitation, matching, following directions? And then we look at all their problem behaviors. And like I said, we want to really tackle biting as probably our number one problem behavior. But if they're also gouging their eyes out, running in the street, those sorts of things, we have to look at the whole picture and look at all the problem behaviors. Then we finally look at biting. When it happens, why it happens. There's probably a couple functions. One is they're in pain. So an assessment would also be a medical assessment, blood draws, doctor visits, ear checks, a dental visit, the dentist, making sure that we don't have any teeth pain going on, because a lot of our kids can't tell us when they're in pain. I also did some video blogs about how to teach kids to tell us they're in pain and the importance of ruling out medical problems. So finally, we want to really focus in on when the biting happens, when it doesn't happen. And then step 2 is making a plan. We want to prioritize the most serious problem behaviors. If biting's not on that list, I would be surprised. But we don't want to forget about the whole picture, because we need to spend 95% of our time preventing biting. Okay, so if we think about, so the happy bites, they occur when the child gets overly excited, like when they want to wrestle, or when I carry my toddler like this, like a baby, he sometimes bites my shoulder, or if you're still breastfeeding, he bites during breastfeeding, or he bites when he's wrestling. Okay, so let's talk about those kind of bites. Even for typically developing kids, and I breastfed Spencer really late, past 2 years of age. And when he would bite, I was told to take him off, put him down, say no, wait at least 30 seconds before resuming. And that worked. Okay. So if you're carrying a toddler and they're biting you on the shoulder, put them down, say no, wait at least 30 seconds, and you may want to stop carrying them like that. And if it's wrestling or something like that, I would stop that. And think of other fun things like spinning a child in an office chair, or rocking them, or bouncing them on a ball. You can still do fun things, but if wrestling has been chained with biting, then we need to stop that. Okay, so that is part of planning, is like, what do I need to stop or change? And I think a lot of parents are trying their best to, be kind and gentle, and I'm a very child-friendly approach kind of person. But with biting, you do need to have the child realize that that's a no. That's no. And you don't have to necessarily say no biting. You could, but when the incident is over, the 30 seconds has passed, we're not talking about biting. We're not telling my husband or my neighbor about the biting. We're not saying, oh, Johnny, you can't be biting, mommy. That's bad. No, it's no biting or no firmly. And then 30 seconds or a minute passes. Then the slate is clear. And if we're talking about biting after that, we are spelling it. Because 9 times out of 10, if you are talking about biting, the child knows, I can get mommy's attention. I can get out of things. I can get things. So assessment, planning is really thinking about okay, what are we going to do differently to get rid of biting? Teaching, and I just covered some of the steps of teaching, which is the third step of the Turn Autism Around approach. Is we're going to spend 95% of our time on prevention. We're going to stop the things that lead to biting, stop the wrestling. But if you want to continue to breastfeed, that's fine. We just need to have an interruption and no, and then wait a little bit and then resume. And putting your child down, not like, oh, no biting, mommy, ouchie, that hurts. Oh, you can't bite. Like, you're still holding them. If they don't understand the language, you saying, oh, that hurt, oh, ouchie, don't do that. That doesn't sound like no. It doesn't sound like there's a problem. No biting. Put them down and then pick them up. That is an interruption. It's a consequence. And it's something serious that we have to get under control. And the fourth step of the Turn Autism Around approach, which is super important, is, and we still track this for Lucas with his self-biting, is we have a calendar, a physical calendar. I talk about this in my book and a video blog. This is old calendar, and I thought I'm just going to keep this back here. We have a red pen and we have a pencil. The pencil is for any, he has people that come work with him. So it's more of like a scheduling, but we also have a red pen in the front, Velcroed in. And this is where we keep track of any self-injurious behavior, any agitation, anything like that goes in the calendar. Then for every doctor visit, for every allergy shot goes in here, any kind of antibiotics, supplements. He has some motor tics sometimes. That goes in here, all in red. And then I use this to help the doctor adjust any medication and those sorts of things. So I would highly suggest you keep a calendar. Also, ABC data is important if you don't know the function and if these behaviors don't go away very quickly. Even using the calendar to say okay, he had 10 bites today, and now yesterday, and now he has 1 bite today, and now he has 1 bite a week. We have to seriously work on biting because it's a serious behavior. I hope you enjoyed that short excerpt from my community. If you would like to be a part of my community or learn more, you can always attend a free online workshop at marybarbera.com/workshops. If you like this video, I'd love it if you share it with others, give me a thumbs up, leave a comment, and I'll catch you next week on another episode of Turn Autism Around.